Well, back to the coronavirus now as we mark 2 years since the pandemic began.
Infectious disease doctor Dean Blumberg from UC Davis Health joins us. And boy, we've come a long way. Cases are low here right now, but they are now climbing on the other side of the Pacific with reports of lockdowns in China. So how concerned should we be? That's where we are headed yet again.
I don't think that that's our future. I think, China really took a different tack in approaching COVID in having their no COVID policy. So their immunization rate is less than we have in the US. And in addition, we've had more transmission already in the US, so that most people, the vast majority of people, have either been vaccinated or infected. So we have some partial immunity throughout our population, except perhaps for those less than 5 years of age. And we expect that further breakthrough infections should be pretty mild and not result in serious disease, including hospitalization or death.
Well, we've been watching more and more of the mask mandates across the country going away. What are your thoughts on extending the mask mandate on public transportation? The date now, April 18th, that it's extended through. Do you think that that is long enough? Should it be longer?
Well, let's see what happens. Everybody has the opportunity now to protect themselves. It becomes more of an individual health rather than a public health issue, so that people can choose to be vaccinated. They can wear masks if they're really worried or at higher risk of infection. They can wear an N95 mask when in public. I think public transportation is a unique situation in that if you're on a plane, you're very close to other people. You don't have the opportunity to social distance. And so it is appropriate to have special rules in those situations. So let's just see how the pandemic goes. And if we continue to have low rates of transmission, maybe that'll change.
Even here in our newsroom, it's the first day we have not had to wear masks. We're seeing some of our coworkers' faces for the first time.
To get
it's
used
very
to, yeah.
Interesting. So we are now entering year 3, and it's still classified as a pandemic. I know you referenced it a minute ago, but really give us a status report and what do you expect the next year to be like?
Well, the wild card is if there's any new variants that come across. But if we don't have those, I would hope that there would be decreased transmission over the summer. We would hope that this eventually falls into a seasonal respiratory virus pattern, just like influenza does. And then we would only have to worry about it in the fall and winter. People would get up to date with their vaccines, make sure they're immune before the season starts, like we do with influenza vaccine. And people would take responsibility for their own health by getting vaccinated, choosing whether to mask or not. And we wouldn't have to have these mandates or not. People could do what they want.
And really, why is that? Why does it settle into the fall and winter months? I mean, it's something we've been experiencing year round, but then as we move along, you say it's just going to be in those months. Why is that?
Yeah, so the humidity and the temperature in the fall and the winter favor transmission and viral survival. But if you have a large proportion of the population that's susceptible, then you can get transmission throughout the year and even in the summer. And remember, we saw that in 2009 with influenza H1N1. There was such a large proportion of the population that wasn't immune that we had sustained and continued transmission in the spring and summer with influenza that year. So it just depends on how much of the population has immunity or even partial immunity.
What do you think are the biggest lessons we've learned from this pandemic that could help us prepare if another one comes along in the near future?
I hope people realize how important our public health workers are, how important the CDC and California Department of Public Health, as well as county public health workers. They're really the backbone of public health and really keep all of us healthy. So I hope people really value the work that they're doing. And the same with the laboratory work that people do. I mean, remember early in the pandemic, it was a challenge to get a viral test. And now anybody can get a viral test anywhere. So I think we've learned a lot about sort of infrastructure and capacity.
And we certainly appreciate you. You've been available to us, and you've really simplified things and made it easy for people to understand. And we especially like what you had to say today. So Dr. Dean Blumberg, thanks for joining us this afternoon.
Thank you.